My name is Dr. Lloyd Hiebert, inventor of the HoverHeat. Current air warming systems are only marginally effective in maintaining patient normothermia. They can only warm a portion of the top side of the patient. None can warm the largest surface area of the patient, the underbody surface. When an attempt is made to do so, the air channels of the disposable blanket collapse and the tiny air holes become obstructed. The HoverHeat is the only air warming system that provides true underbody warming. The HoverHeat, by its proprietary internal components, accomplishes this first by levitating the patient, second, providing low resistance warm airflow under the patient, and third, providing patient comfort by being gentle to soft tissue. The complete underbody surface of the patient can now be warmed. This innovation will increase the warming capacity of your current warm air blower by 50 to 75%. The good news is the HoverHeat can be used with any warm air blower that you currently have. Simply insert the cuff into the air inlet. If your cuff does not fit, use the HoverHeat adapter, which will accommodate any hose diameter, and insert the adapter into the air inlet. Before placing the HoverHeat on your preoperative or operating table, place an insulative layer of at least 2 towels or a Conrad thermal blanket, patient side up, between the HoverHeat and the underlying surface. This prevents conductive heat loss to the underlying surface. Then place the HoverHeat on the supporting surface with the air inlet in the direction that is most clinically convenient, and place the patient longitudinally on the HoverHeat. The HoverHeat has the flexibility of being used on a flat surface like an OR table or on a curved surface like the HugUvac positioner. The HoverHeat can also be used synergistically with the Conrad thermal blanket to maximize heat retention. Place a towel between the patient and the entire surface of the HoverHeat to prevent convective heat loss to the environment and to absorb body fluids and irrigation solutions. Although it may be obvious, monitor the temperature settings of your warm air blower and the temperature of your patient. If underbody along with overbody warming is desired, insert one end of the HoverHeat connector into the air outlet of one HoverHeat. Then insert the other end of the connector into the air inlet of another HoverHeat. This, in effect, makes a heat sandwich, which allows you to warm the underbody and the overbody surfaces with one warm air blower when clinically appropriate. Arrange the underbody and the overbody HoverHeat units in a fashion that provides the most effective warming, and cover with a blanket to maximize heat retention. The HoverHeat is the only air warming system that can provide true underbody and overbody warming with the same warm air blower. The HoverHeat system is a natural for preoperative prep, during which warming is critical in banking body heat, anesthetic induction, surgical procedures, dental procedures, endoscopy, postoperative recovery, and imaging. The HoverHeat is easily cleaned with a germicidal spray. The HoverHeat units come in small, medium, and large sizes to accommodate any warming situation. Finally, one air warming system that does it all.